Thank you so much. I'm so happy to be here today. It's good to see so many of you in attendance. So today I'm going to be talking to you briefly about a study that was conducted around Hurricane Sandy, even though it's hard to believe it was almost 10 years ago. The project's called the Sandy Child and Family Health Study. We call it the S-CAFH project. I want to recognize my colleagues who worked with me, including NYU, the Global Institute of Public Health, and the National Center for Disaster Preparedness at Columbia University. Okay. So I am presenting Hurricane Sandy as an example of how climate change has impacted us. Hurricane Sandy, or as we know, it's Superstorm Sandy, actually hit New Jersey and New York in October 29th, 2012. It's so hard to believe. It only killed 233 people immediately, but we do know that the destruction extended far beyond those couple days when the storm was with us. It inflicted nearly $70 billion of damage in the US. So the question of how we connect a weather disaster to climate change, so we want to know how much climate change is affecting storm impacts and extreme weather trends, and how vulnerable are our coastal populations in infrastructure to those changing risks. So the study really wanted to examine what I now call the long-term impact of Hurricane Sandy. When we first applied for the grant, it was in 2012. It took several years until 2014 for us to actually begin to collect data. So we were looking at the health and well-being of children and families. And we wanted to examine the ongoing needs of affected residents, services, and the factors that helped or hindered recovery. I want to thank our funder, the New Jersey Department of Health. Again, S-CAFH is our study looking at those, we call them long-term effects at the time. We wanted to see a couple of years post the actual impact to see how were the communities and individuals faring. We did a random sample of 1,000 residents living in or near those coastal areas who were most exposed to the storm. So we call that a cohort, and it's representative of the nearly 1 million residents who were living in what we call the disaster footprint. I'll explain that now. So the disaster footprint is actually a combination of three interesting pieces of data. The first one was a storm surge data that showed us that it was greater than 1 foot. And you can see that we found that with satellite imagery along the coastline. And then the FEMA individual assistance claims with zip codes, again, along that area in the most affected counties. And then we did an overlay of housing damage by census block groups with greater than 20% assessed units sustaining damage. So we put those all together and we found the 9 most affected counties. We called them very high impact for a total population of a little over 1 million individuals and a total households of 411,000. So this is our data, but before I say that, I'd like to tell you that the way we collect the data was actually kind of interesting. So we sent research assistants, basically students, graduate students, out in the community, and they went door to door with tablets, electronic tablets, and asked hour-long series of questions to households. We knocked on doors, we had to get permission. It was a very difficult time. We were following the storm surge, it was still, even though it was just 2 years later, there's still a lot of damage. It took a long time for insurance to help individuals rebuild. FEMA, we know how slow it takes for government to respond. A lot of these communities were very fearful. There were people who were afraid of continued damage or that things were going to be further destroyed by other storms that might follow them. They were also very suspicious. So we had to notify the police that we were going to be in the area. We had to make sure that the assistants were carrying signs that they were from Rutgers, that was okay. We had authorization to be there. So this just shows you that we were taking a look at household characteristics, the North and the South in New Jersey. Before we started talking, I was joking about the fact New Jersey is a very interesting state. I'm from Chicago. And when I first moved here almost 20 years ago, it's hard to believe, there is a difference in the state. There is a difference between the North and the South. It's almost like a dividing line for Route 78, if anybody knows the state. And I forget which it is. In the North, people up in the North, I think, eat Taylor ham, in the South eat pork roll. There's a difference in the foods that we eat. So there's a difference in how we responded to the actual damage. There's also, we looked at major and minor damage, and also those who had no damage. We also looked at income. We knew that income would affect how people recovered from the damage that they were dealing with, and whether or not there were children present in the home. And you can see there's probably between close to 40% of the homes had children, which was a major interest of our group. I show this slide again to help reframe our discussion back to those 8 years ago, to see how the damage was. We could see so much of the sand came up from the shore, roads were blocked, homes were destroyed. It was a very scary time for people. Children were not able to go to school, people were not able to go to work. It was a very difficult time brought on by weather we believe was caused by climate change. So the questions we had in the study about housing: what decisions did residents make in the run-up to the storm? And what was the impact? And what help was needed and sought? So 215 people lived in mandatory evacuation zones, but only 33% evacuated. I remember some of these stories back in the day when they were telling people to evacuate. They were getting on the radio and TV and on the internet, and people were not willing to leave. And if of those million people that lived in an actual disaster footprint, only 23% evacuated, despite all the public health announcements that were being put out there. Why? Well, first of all, those in the South were 4 times as likely as those in the North to evacuate. If you recall a disaster footprint, there were more people living in the South. The storm hit more hard in the South. Women were more likely, more than 2 times likely as men to evacuate, and most likely bringing their children with them. But the question is, why didn't they evacuate? People thought they'd be safe. They didn't think the storm was going to be so bad, and they had lived through other hurricanes, so they decided to hang on. So among those with major damage, 7 out of 10 needed help restoring or repairing their home. That kind of gives you a magnitude of that damage, 7 out of 10 people. And of those who needed help restoring or repairing their home, 1 out of 7 did not seek assistance. This means a lot of people were seeking assistance. And this was actually an interesting study, another study that I did around people who are the new needy, people who are more middle class, who never asked for assistance before, now had to step up and think about themselves as needing assistance. It was a change in the landscape of those reaching out for social service and support. Among those with major damage, about 4 out of 10 needed help elevating their home. This is something you really can't do alone. So 4 out of 10 tells you how severe the damage was and how much help those individuals needed. And among those who needed help elevating their home, about 5% did not seek assistance. That's a very small sliver of those who needed assistance. So now moving into health, what is the relationship between disaster exposure and health outcomes? Exposure meaning being in the storm, being in the rain, feeling the winds, feeling some of the debris flying about. And how were kids affected by the storm? So the exposure to disaster on health outcomes, we looked at that both population, New Jersey statewide, as well as individually. And then we looked at physical, emotional, economic well-being, and social well-being. With respect to individual exposure, 8% reported having direct harm, being harmed, but the contact, 62% of people, even though if they weren't directly harmed, they had some sort of contact with flying debris, the wastewater, flood water, sand, something related to the storm. 11% had major housing damage and 9% had minor housing damage. Again, the impact on physical health, poor physical health related quality of life, 24%. Quality of life is your ability to really live and engage in your environment, participate in recreation, social activities, just enjoy your life. 24% had poor physical health related quality of life. And 13% said their health got worse since Sandy. 13%, that's actually a pretty big number. That's both, that could be their blood pressure got worse, their asthma got worse, something got worse for them. Emotional health, 7% reported PTSD. Post-traumatic stress disorder is an extreme reaction. This is someone who's having flashbacks, someone who's experiencing hypervigilance. The average number of people in the general population who experience PTSD for whatever reason throughout the year is about 6%. So 7% really isn't that much higher, but that again is an extreme reaction. But moderate and severe distress being a lesser reaction, is about 17% for the overall population in this study. Social well-being. Those who were exposed to disaster, 37% had poor family functioning. This includes divorce, fighting among family members, anything that would involve delusionment of the family structure. And then weak or absent social supports or networks. We do know we lost a lot of older adults because of Hurricane Sandy. People who lived alone died. So that weakened the usual social supports within the community. And then economic well-being. Household income decreased. Almost 20% had an income decrease. They lost their jobs. They couldn't work as much. The financial constraint was 12%. Many people gave up their retirement incomes to their children to go on to college. Many people had to use their retirement incomes to fix their homes, their living situation. So this is kind of interesting, dose response relationship, meaning how much of the exposure increased how much of the response. So in relation to PTSD, people who were directly harmed were 2.8 times more likely to have PTSD. That's not so hard to figure out. If you're more likely to be harmed, I mean, you're more likely to have PTSD. But even having contact with floodwater, debris, or mold, you are more likely to develop PTSD. Mental health distress, the same thing with direct harm, major housing damage, and that direct contact with floodwater, debris, or mold. That's something I never really thought about until we did this study. And I also know from another study we did, first responders, so paramedics, other EMTs, other people going door to door to help out, who had direct contact with floodwater, debris, and mold, also had higher levels of mental distress. And remember firefighters talking about finding pets that had died in the water and how distressing it was to them. So this impact is all across the community. Asthma diagnosis. Not surprising that exposure to mold increased the response and development of asthma, 2.6 times more likely to develop asthma if you had exposure to mold. But if you were directly harmed, you were 4.5 times more likely to develop asthma diagnosis. Why? I don't know, is open to further study. It's so interesting. These are things you don't think about, but it was very interesting for us to kind of tease out. And the same thing with mental health distress. If you had direct harm or major housing damage, it makes sense that your mental health distress goes up, but exposure to mold increased your mental health diagnosis. I know living in an environment where there is mold would distress me. And I do remember during this time, many people cleaned out their homes, put their furniture and household belongings, clothing into these, they call them pods. They sat outside in their lawns to kind of get them out of the homes for them to rebuild, but didn't think about the fact that they did this in the spring and then it was hot and it was moist. So when they opened the pods, everything in those pods were moldy and they had to throw them out. The other thing adding to mental health distress during this time is that there were a lot of people who were there to help ameliorate the mold in their homes, but they took advantage of people. They would just lay down new drywall over moldy surfaces without eradicating before they cleaned and put the new the new wood or whatever covering in. So it was financially a problem and also distressing. They had to go back and redo the work. So some of the measures of mental health distress, and I know Nicole's going to be talking more about this. Again, I mentioned 7% of the residents had PTSD, slightly higher than the national average for PTSD in a given period of time, but it was as high as 19% among those with minor housing damage. So we can't discount the fact that someone had lesser damage. They still can have an extreme reaction to that damage. Over 1 in 4 residents with housing damage have moderate or severe mental health distress. We certainly saw that. I was really interested in this finding about risky behaviors. 37% of New Jersey residents in general in that disaster footprint along. So I was going to talk about child health and well-being briefly. So children living in homes with minor damage were at particular high risk for psychological and emotional issues. I'm not sure where I left off, but not if I'm repeating myself, I'm sorry, but we suspect that those children living in homes with minor damage were higher risk for psychological and emotional issues because children in homes with major damage would have probably been moved out of their homes. But those who are living in this constant reminder of what happened can be very scary. It'd be scary for adults, scary for children. And children have a way of filling in the blank sometimes what they're thinking with scarier things, through magical thinking, through things that their imaginations can run wild. So compared to children from homes with no damage, these children, oh, sorry, I didn't share my slides completely. Compared to children from homes with no damage, these children living with minor damage were 5 times more likely to be sad or depressed, 5 times more likely to be nervous or afraid, and 8 times as likely to have problems with sleeping since the storm. So even the minor damage we need to pay attention to. So in homes with minor damage, 22% of children had been diagnosed with depression or anxiety since Sandy. That was a clinical diagnosis that they were given compared to 2% of children in homes with no damage at all. So my final slide was encouraging that we should in the community be monitoring and surveilling around things like hurricane damage and other severe weather, to be thinking about that as a risk factor for acute and chronic disease. Maybe thinking about a damage registry like a toxic exposure, areas where they were mostly impacted, what's happening to those kids today? The same way we did with the kids who are post 9/11, I know that they're following those kids into the future to see what happens. And we do know suicidality and substance use is high in that population. Consider more refined screening of household members on those damage registry for physical and mental health issues, what's developing over time, especially when we saw that the smoking was increasing. And then pay particular attention to children in damaged homes, particularly the mental health screening, develop an integrated approach to address mold, since we now know mold does have an impact on mental health as well as physical health. And then finally, alert pediatric community, physicians, school teachers, librarians, anybody interacted with children, to ask their patients, particularly the pediatricians here, about hurricane exposure and damage and explore mental health issues. And that was my last slide.
So before I get started, I do want to say thank you, Kendra, and to the Rutgers School of Public Health for organizing and hosting the conversation. My brief presentation will specifically discuss findings from the newly released Mental Health and Our Changing Climate report, which was published by EcoAmerica and the American Psychological Association back in November of 2021. And that really dives into the impacts of climate change on mental health and well-being, but also on how to build resiliency and take action. So I'll start with a brief introduction about who I am. I'll go over the report in more detail, dive into the context, the impacts of climate change on mental health inequities, and then I'm going to close it out talking about solutions. And I also want to add that in this discussion, sensitive topics, including sexual assault and suicide, will be briefly mentioned on the slides. So I give that as a warning and opportunity to anybody who doesn't feel comfortable to leave the webinar at any point. Like I said, my name is Nicole Hill. I'm the Research and Marketing Manager at EcoAmerica. And in my role, I primarily work on researching American attitudes on climate change and how they fluctuate over years. I'm also a co-author of the Mental Health in Our Changing Climate report. And then a little bit about EcoAmerica. We are a nonpartisan, nonprofit organization working to build institutional leadership, public support, and political resolve for climate solutions in the United States. And we do that by engaging trusted sectors that Americans look for guidance and direction, including, and importantly today, the health sector. So here's the report for reference. I hope during the question and answer session at the end, I'll be able to get to everybody's questions, but if I don't, the report is a great resource to look for answers. And I'll offer a little bit of context before diving into the explicit impacts of climate change on mental health. So I think it's important that I provide an overview of the links between physical, mental, and community health. And you can actually find this image you see on the screen on page 16 and 17 of the report if you do choose to read it later. The important message here is that while climate change directly impacts physical, mental, and community health, we must remember too that they're all interconnected. So individual mental health is connected to our physical health impacts our mental health, and community mental health is influenced by both. And this image also illustrates that not all Americans are affected equally. So there are certain people who are made more vulnerable. But to illustrate, imagine you're a person with asthma. And as our climate changes, you will experience more frequent asthma episodes. Dr. Finley was just talking about this when she got cut off, but this can cause you stress and anxiety. And because of your activities being limited, it can also lead to depression. And so given the rise in incidence of asthma overall, not only you, but others in your community may also be experiencing the same symptoms. And so understanding the interconnectedness can help us better plan to protect our mental health as our climate changes. And it can also help us create more effective climate policies that consider mental health and well-being. And then another aspect of climate change and mental health is who has access to decision-making. For example, if you live in a community that's experiencing disinvestment, or perhaps you're too young to vote, but you're not too young to understand what's happening around you, you may become frustrated and isolated if you can't influence the systemic change. So not to jump ahead to solutions too much, but I encourage you to think about the ways in which you solicit and incorporate community feedback into your climate actions. So many reports show a rise in concern about climate change amongst Americans. EcoAmerica research last year found that 78% of Americans were concerned about climate change, with 48% saying that they were actually very concerned. However, only 59% of Americans believe that others around them are concerned about climate change. And actually, in a report that was released just about 2 months ago, we saw the gap in actual versus perceived concern grow. And in the more recent survey, while 48% said that they were personally very concerned about climate change, only 14% said that they thought others around them were concerned. So it's 3 times as many people are very concerned than people actually think. And that gap in actual versus perceived climate concern could be contributing to silence on the issue. Perhaps people feel alone in their concern and they're afraid to step outside of their group's norms. This is called pluralistic ignorance, and I'm going to get into it on the next slide. It's a psychological barrier to taking climate action. Okay, so while most adults in the United States actually do express concern for climate change, and a majority do favor efforts that ensure a sustainable planet for future generations, it hasn't yet translated into the personal and into the political action that's necessary for these solutions at scale. So there's several psychological barriers that are holding back action on climate change, and these include psychological distance. So this refers to the idea, you're probably familiar with it, that climate change is a distant worry. It's something that's going to happen to others at a future date, but it's perceived as something that's not going to harm you right now. And even though concern is high, only 45% of Americans say that they're personally at risk from the harm of climate change right now. So this sense that climate change is a distant problem creates a barrier to personal and public engagement with the climate crisis. And then belief systems play a huge role in how we think about climate change too. Many proposed climate solutions, such as large-scale governmental programs, conflict with political worldviews that prioritize limited government power. So this explains in part why conservative political identity, for example, has become a predictor of climate change skepticism. And then, as noted, pluralistic ignorance is the idea in which people's ideas about what a group thinks can differ from what the group members actually believe, and that can inhibit the acknowledgement of a problem. Fractured hope. So those who lack hope that climate change can be fixed and believe that there's no way the climate crisis can be solved are actually less likely to take action. It's an important ingredient in proactive response to believe that solutions work and that climate change can be addressed. And so fractured hope can get in the way of that action. And then finally, the need for efficacy. Studies suggest that we both need to believe in ourselves, that we have the ability to take necessary actions, that's self-efficacy, and that those actions will result in helping solve climate change, that's outcome efficacy. So despite these barriers to action, the good news is that they can all be overcome with visible leadership and action on climate change by people that Americans know and trust in their daily lives. One study found that people were far more likely to get involved in public sphere action, such as donating money, contacting their policymakers, attending protests, if they believed that their social group was also participating. So visible leadership and action from health professionals, and I'm jumping ahead to the last bullet here, but that can also prove to be really helpful. Just last year, 68% of adults in the United States said that they trusted health professionals as a source of climate change information. Then personal experience with impacts, or better yet, personal experience with solutions can be important. People are feeling the effects of climate change today already, and often after experiencing an extreme event, it will stay salient in your mind. People in the United Kingdom who had experienced severe flooding events not only felt more at risk from climate change afterwards, but they also expressed greater willingness and greater support for policies that address climate change. And then finally, helping people see that connection between climate and their family's health, both on the impact side and then again, better yet, on the benefits of solutions to support health can change behavior. Providing information about the personal health benefits of specific climate mitigating behaviors can lead to greater expressed willingness to adopt those behaviors, such as replacing driving with other forms of transportation, such as walking, active transportation, or eating more vegetarian meals. And then on to how climate change impacts mental health. So Dr. Finley was giving a great informative overview of the impacts of Hurricane Sandy, but there are other disaster events associated with climate change too. So between hurricanes, flooding, extreme rainfall events, wildfires, and other events, there's hardly a region of the United States that has been unaffected by climate change. So like Dr. Finley was showing us, these events have real personal impacts that can harm mental health, and these include trauma and shock. Direct trauma from extreme events can occur through personal injury or injury of a loved one, property loss, loss of pets and livelihood. PTSD rates are found to be as high as 30 to 40% among disaster exposed people, and it can last for years. And then other impacts include anxiety and depression, increased stress-related physical health problems, and strains on social relationships. And then experiencing an extreme weather event also uproots communities and it weakens social ties. So at a minimum, people may be temporarily displaced and unable to experience their usual social interactions. And this is important because a supportive social context is strongly associated with both physical and mental health. So without these social connections, people are increasingly vulnerable to stress. And experiencing a disaster that's so intense that one needs to leave their home, such as with Hurricane Sandy, and leaving their community can be particularly traumatic. And displacement is linked to higher rates of PTSD, along with negative mental health outcomes, such as anxiety and depression. And then losing one's community, either because it was destroyed or because of displacement, can also threaten people's sense of belonging and their sense of identity. People are often not aware that the chronic impacts of climate change are also really dangerous. So the three types of chronic impacts I'll focus on today are heat, drought, and poor air quality. Heat affects mental health because it's a physiological and a psychological stressor. Increased temperatures are linked to mood and anxiety disorders. They're linked to schizophrenia, vascular dementia, and also greater use of emergency mental health services. Drought causes psychological distress, including generalized anxiety and depression, and particularly actually for farmers and farming communities or people who are economically affected by drought. And then the factors that contribute to climate change, particularly the burning of fossil fuels, also contribute to air pollution, such as increased particulate matter. And air pollution can increase the risk of anxiety and other mental disorders. It impairs cognitive function, and it predicts lower ratings of happiness and life satisfaction. And there is evidence as well that air pollution has long-term impacts on children's cognitive development and mental health. And then finally, two other ways that these chronic impacts of climate change affect people's mental health is by changing the places that people live so dramatically through sea level rise, for example, or species loss, that people lose their sense of place, their sense of attachment, and even to some extent, their sense of self and identity, as well as sense of having control over their lives. So the chronic impacts of climate change can also have community level outcomes. One is a loss of culture and tradition, and this has particularly been studied in cold climate indigenous communities that have been affected by rapidly rising temperatures. Indigenous peoples often report a strong attachment to the land, even a sense of relationship to it, and it can be important to traditional practices and traditional foods. And warmer temperatures due to climate change prevent that long-standing cultural practice. And then a second community level outcome is an increase in hostility and an increase in conflict. So rising temperatures are linked to interpersonal aggression and violence, including domestic violence, assault, rape, and even murder. And converging evidence suggests that climate change may be a contributing factor to intergroup violence, such as political conflict and war. And then on to climate anxiety. So this term has been in the news a lot recently. Maybe some people are familiar with climate anxiety. Even among people who haven't experienced the direct impacts of climate change, simply knowing that it exists and having a sense of the problem can be accompanied by negative emotions, including fear, anger, feelings of powerlessness, and exhaustion. In a 2020 survey by the American Psychological Association, about 2/3 of respondents said that they had felt at least a little of this kind of anxiety, and about 1/4 of them said they felt a lot. Negative emotions about the climate crisis don't always constitute mental illness, but watching the slow and seemingly irrevocable impacts of climate change unfold and worrying about the future of oneself, worrying about the future of someone's children and later generations can be a source of stress and sadness. And that's what is referred to when we talk about climate anxiety. It also appears to be more prevalent among younger adults, and international research shows that negative emotions about climate change are associated with lower mental health. So it's important to note that while the destructive impacts of climate change will be felt by everybody in some way, the burdens of climate change are going to fall most heavily on people who've been oppressed by historic and present day social, economic, and political power dynamics. And climate change is a real destabilizing force that exacerbates pre-existing socially determined vulnerabilities, which makes some populations more prone to the mental health difficulties. An example is people who are economically disadvantaged. So living in poverty is a real risk factor of its own. It's linked to poorer physical health, greater likelihood of being a victim of a crime or other form of violence, and higher risk of depression and anxiety. And individuals with serious mental illness may be more likely to be unhoused or less likely to regulate their own behavior in response to dangerous environmental conditions. Add this to the fact that the economically disadvantaged people are more likely to be exposed to a disaster because poverty pushes people to live in areas with higher disaster risk. And in the aftermath of a disaster too, those with lower wealth have less access to the material resources that help people cope and recover following extreme weather, for example. And so all of these factors contribute to the higher risk of stress, depression, and anxiety experienced by people who are economically disadvantaged after disaster. Discrimination and systemic racism in the United States expose racial and ethnic populations that have been marginalized to a wide array of environmental risks, while also simultaneously denying them access to the financial and political resources that could help buffer those impacts. And so one stark example of this is how historically discriminatory housing policies such as redlining and racially restricted covenants have forced people of color to live in dangerous, heat-prone areas. And you'll hear more about that from Dr. Sabri in the next presentation. And so I don't want to be repetitive in talking about redlining, but disinvestment in urban areas with high concentrations of people of color has led to outdated infrastructure, such as inadequate warning systems for extreme weather, poor flood preparedness, and clogged or deteriorating storm sewer systems. And these infrastructure failures expose residents to more of the physical impacts of climate change, which in turn makes it more likely that their mental health and well-being will be affected too. And all of these factors put a heavier burden on Americans of color, making them more susceptible to depression, anxiety, and psychological distress brought on by the climate impacts. Indigenous communities threatened by climate change are found around the world, including in Alaska, where villages are vanishing as permafrost thaws, and then also in the Gulf Coast, where the shoreline is eroding. And being forced to relocate because of climate change, or even thinking about needing to relocate, can cause significant stress. It can weaken social connections and increases levels of conflict within communities. Climate change threatens Indigenous ways of life in numerous other ways as well. Indigenous personal and cultural identity is often directly tied to the land, which we were just talking about, through history and through lived experience. And when the land is irrevocably altered, it deeply impacts those who are connected to that land. So shifts in climate and weather affect Indigenous communities' food security, their traditional cultural practices, and their attachment to place. So it's not surprising, but it is still very troubling that a recent systematic review of the literature indicates that suicide, depression, and anxiety among Indigenous populations in North America are linked to both acute and chronic weather events. And I know Dr. Finley, when she finishes her presentation, is going to give an overview of Sandy's impacts on children. So I won't spend too much time here, but I'll add that climate change is going to impact children in numerous ways. One of them is less direct as well. So for example, their schooling may be interrupted due to climate change related disaster. They also may be impacted by the vicarious experiences and mental health of their caregivers. And so since children are especially vulnerable, they are made especially vulnerable because they really rely on others. They rely on their parents, their caregivers, their social connections in their communities to ensure their well-being. Additional populations that are made vulnerable to the mental health impacts of climate change are listed here. I don't have time to dive into all of them today, but they are outlined in the report. So I would encourage you to read the report and learn about these in more detail. Okay, so while the impacts of climate change on mental health are profound, solutions are abundant and solutions are accessible. So let's get into it. And in being cognizant of time, I'm going to focus on promoting resilience in communities rather than individuals, but I encourage you to take a look at the report for resilience in individuals. Okay, so promoting resilience in communities and sticking with the public health approach framing that is used in a lot of the work in health departments. A strong community can be a source of stability and safety for its residents, and all humans fare better when they perceive the world around them as orderly and predictable and benevolent. And as we know, an individual's ability to mitigate disaster risk is profoundly shaped by the policies and decisions that are made by people in power at the community, in power at the state, and at the federal levels. So with that in mind, we put together this set of suggestions for how communities can create conditions that will make life better for everyone, in particular, those who have been most vulnerable and been made most vulnerable in the past. So this includes steps like expanding response and resiliency plans, addressing inequities, strengthening mental health services, updating physical infrastructure, and developing effective warning systems. And then meaningful local climate solutions are also within reach. Communities can take thousands of actions on climate that benefit our mental health. So a few ideas to get started is you can inspire change by making a public commitment to climate solutions, and you can feature it online. You can feature it in all of your communications. Focus on the benefits and the cost savings that people in the community will realize with the solutions, and how investing today will make the community stronger tomorrow. You can also aim for quick successes with easily achievable and affordable steps that can be put in place easily. and put in place quickly. You can establish priorities and make informed plans with goals for energy efficiency, renewable energy, electric and active transportation and mass transit. You can also engage and communicate with leaders in business, education, mental health, and faith, those who are already making commitments to climate solution in ways that are non-politicized. You can embed solutions and then recycle the savings. So climate and sustainability solutions should be part of ongoing business and local governance rather than being set up as a separate project. And then the initial savings from reducing energy and water use, for example, can be used to support the next steps. And then you can build on and adapt to results. So these plans can always be adjusted, and they should be as new opportunities arise. And then what individuals can do in the community. So I won't dive too deep into here because I know we still have other presentations to get through, but we all have more power than we think to affect progress at the community level. So we don't need to wait for somebody else to engage. We can be the ones that we've been waiting for. And so here are some steps that as an individual you can take to build resilience in your community. And then finally, what mental health professionals can do for anyone, any mental health professionals listening, and then also as health professionals, you're very trusted. So as local health leaders, your community does look to you for information and advice. So you can become a climate literate professional and learn to stay up to date on climate change and the impacts of mental health, like you are doing today in this webinar. The first step in climate leadership does start with literacy. So start by learning how climate change impacts mental health and all the ways to protect it. Then engage other health and mental health professionals to share your knowledge or collaborate with them on programs and research. Climate leadership can also extend to fellow mental health colleagues, many of whom are just as concerned as you are about climate change and might appreciate being invited to engage on the issue. Then be visible and be vocal leaders within your community by giving talks, participating in events, or serving on planning committees for resilience or climate action plans, and support national and international solutions. Again, thinking about what you can implement and building on that for large-scale systemic change. Health and climate experts are trusted professionals, and they really do have the power to influence policymakers at all levels of government. And then these last few slides are just resources that you can use that are featured both in this PowerPoint, which you'll have a copy to access afterwards, and also feature them in the report. So thank you, and I'll pass it on back to Kendra.
Thank you for the invitation to be here. And so let me share my screen. Okay. And so today, just really talking environmental justice, as we talk about climate change, mental health, physical health, and really the impacts of it on individuals and communities. We also, I think, need to talk about what is the particular context behind those pieces, and what are some of the ways to actually engage with these pieces, right? And really talking in that sense, when we're talking environmental justice, what does that really mean? Okay. And so today, I'm talking from perspective as a Black American psychologist, clinical psychologist, and as a part of that, also talking from the perspective as an American descendant of slavery, right? And so talking today in that sense is what and why of environmental justice from this perspective, the importance of praxis with that, and the history of, the American descendants of slavery, Black American, and within the environmental justice movement, and then how to focus on your own local advocacy as a part of that as well. Okay. And so thinking as a part of that, starting with what is environmental justice? So I'll read the quote here. And the quote says, environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And so this comes from the EPA website. You can find it EPA.org, right? And so really thinking, we're talking about trying to, I think engage climate solutions, engage really proactive ways to really adapt and try to really at the. And so as a part of that, I also talk about the structure really of white supremacy within that, and really talking about that as the frame for like systemic racism. And so I have a quote here that says, "The available evidence suggests that the racialization of the world system emerged after the imperialist expansion of Europe to the New World and Africa. Furthermore, this racialization led to the development of what Charles W. Mills called global white supremacy. So racial order structured along the axis of white or European and non-white or non-European." And so really thinking about the creation of economic advantages and various policy advantages, for white Americans, while also denouncing and creating systemic barriers for Black Americans, right? And really seeing how that has, again, proliferated a lot of our environmental issues as a result of that. All right, and so it makes me think about really the inception of the environmental justice movement and really some of the beginnings of it, like within the Black American community. Right, and so this takes me to the Memphis sanitation strike in 1968. Martin Luther King Jr. was one who ended up, advocating for the better pay and the working conditions for American descendants of slavery men. But really, he kind of came in, I think, after it had already started. But really seeing that this was the first time that there was a national push, like within the Black American ADOS community at a national level against environmental injustices. Right, and so thinking about environmental justice is also not just necessarily directly centered on, okay, the area that I directly live in, but also where I work, the places in which I work, the conditions in which I work, right? And these are all important parts of that as well. And so this graphic comes from Ben and Jerry's. So folks like their ice cream. They seem to be pretty cool place to support. They put out this graphic, I think, within the last couple of years. And really, so I also kind of added the piece of really talking about it as not just 400 years of systemic oppression, but also 400 years of different forms of systemic oppression. Right, and so that also means 400 plus years of environmental injustices. Right, and so we're going to try to, I think, I'm going to offer a frame for that, again, from the perspective of, Black American history. Right, and so it makes me think of, when we're talking environmental justice, like within the literature, we see Dr. Robert Bullard. He was one of the first Black American ADOS scholars to really talk about environmental justice in the literature. And really that was because he wrote several books, he's published several articles, really talking about the various toxic environments that Black Americans have lived in, over the centuries, thinking about places within Louisiana, North Carolina, and so forth. And just talking about trying to give voice and exposure to, to these injustices in order to be able to say, hey, we need to have change. There needs to be some kind of push for policy change. And so really publishing a lot of notable works in that sense, talking about toxic dumps, air pollution, and waste. Right, and so Nicole had mentioned the redlining piece, and so I was going to talk about it here more specifically. And so what you see in this picture, this is a picture of two places within Washington. So on the left is University Place in Washington. And then on the right is this neighborhood in the city of Tacoma, Washington. Right. So, I mean, you can immediately notice really a difference in the contrast of just, I think, the urban planning and the layout. Right. And so saying the community on the left is the suburban community, right? So University Place tends to be more affluent. And then noticing higher amounts of tree cover, really, which also points to more biodiversity. It points to often things like more parks, just more tree coverage, so more shade, lower temperatures in the neighborhoods, right? And then you zoom over to the right side, kind of being in that urban context, right? And seeing really no tree cover, right? And seeing that because of that, that often leads to things like, urban hotboxing, right? So communities just getting hotter and then throwing in climate change, excessive heat on top of that, right? And then less tree coverage means less biodiversity, less animal diversity. So we can go down the list. We can even see how, as with, less tree coverage, you have really less air filtration because now there's not trees to kind of filter out a lot of pieces with the air as well. So you start to see how things like redlining, systemic racism, and zoning policies and things and so forth really create a harmful environment in terms of biodiversity, which also then segues with us in terms of our own health. Thinking of redlining. So redlining, in essence, historical discriminatory, housing policies, really means that often communities, people of culture have been significantly more likely to live in risk-prone areas, right? And so living in areas where there's more exposure to harmful particulate matter in the atmosphere or, contaminated soil and so forth. Right, and so really seeing this within various studies that are starting to come out. There's a meta-analysis in 2020 by Shell et al. That had reviewed these really stark and alarming figures, really seeing how there is a trend in how redlining and oppressive housing policies also continue to create environmental harm. And so, as a part of when I'm talking about this and really trying to provide context again, I always like to talk about my, really my own history within that, being a Black American, being ADOS. So this is a community within Michigan, Royal Oak Township. And so this is where really a large portion of my family grew up. Just pictures like this is corner store in the neighborhood, really prominent and kind of connected neighborhood, which over the years has been through a lot of divestment and a lot of issues that have really caused, just kind of community, I think, disenfranchisement, unfortunately. And as a part of that, what we've seen is still seeing issues with environmental injustices. So in 2020, like most of before 2020, Flint, Michigan has had many issues up until still now with the issue of lead, and lead pipelines. Right, and so they found that in 2020, two of the homes in Royal Oak Township in this, photo, right, and so tested positive for lead. But to qualify for testing to say, okay, we can test your water within a home, there was a lot of stipulations placed. So this is a quote from a news article. And it said, to qualify, a home must be connected to Royal Oak Township's water supply, have a pregnant woman and or children under the age of 18 living or spending considerable time in the home, and be on WIC, Medicaid, or be willing to say that you cannot afford the cost of a water filter. Right, and so really it creates this situation where people can't access the actual test. Right, and so a large portion of Royal Oak Township's residents are also elderly. Right, so you're talking about people who may not have someone kids under the age of 18, right, or they might not have a pregnant woman in the home, right? But they still need access to that lead testing, right? And there still needs to be that real mass level of lead testing to say this is maybe an infrastructure issue, which if you're talking about 2 homes in an area testing positive for lead, there's probably a good likelihood that there will be more homes that are going to show up because you're talking about the water supply. And then this is a picture of what we call the Detroit Wall. So there's a section in Detroit where really it was sectioned off kind of it's called the Berwick Wall, the 8 Mile Wall, sometimes the Wailing Wall is what you'll hear too. But really it's a stark representation of segregation, right? In the sense that neighborhoods were cut in half as white residents really moved into Black American neighborhoods and really tried to create some kind of boundary, some kind of barrier, right? But then again, this is another issue of environmental injustice, right? So now you've created a barrier where not only can kids have to stay on one side and okay, now their livelihood is playing on a wall, right? It creates a very, I think, similar image to other images we've seen, over the years, right? The Berlin Wall, for instance, like that, where it's really, the purpose is to say, you need to stay over here because you're not allowed to be on this other side. Right, and so what we see is often really urban renewal projects within many Black American, predominantly Black American cities, created a lot of erasure. And again, another side of environmental injustice because now you're bulldozing neighborhoods, really removing infrastructure from people's livelihoods and communities. And so this is a picture of what we would call Paradise Valley. And so was a section of Detroit where you would often hear synonymous with like Black Bottom. So really it was this idea of a very prosperous Black American cultural nexus, right? And so within the city of Detroit, but then what ended up happening was the construction of a lot of the interstate freeways through Detroit were intentionally navigated through Black American neighborhoods to say, we're going to bulldoze these neighborhoods in favor of putting down these freeways. But again, then creating these massive injustices. And now, within the last 5 years, Michigan, Detroit has seen, more historic flooding, right? And within those freeways as well, right? And so seeing again how now because of these policies and because of these acts and oppressive forces, now you've created really the perfect situation to exacerbate a lot of those vulnerabilities. Right, and so thinking again, similarly, this is a picture of residents within Convent, Louisiana, and they were protesting the establishment of the PVC plant in their community, right? And so PVCs can be harmful when you have a lot of that particulate matter being put out into the air, right? And so it took them 2 years to have that recognized, right? And so really thinking about how there's been so many environmental protections cases, litigations over the past decades, right? And really thinking how many of those have been within Black American communities, right, that really need it. And so my question often is, how do we focus on reparative justice from a socio-ecological standpoint, right? Because that is an important part of this picture too. And then always, why is it important for mental health? Right, so thinking of, again, this is a image of just lead service lines within, various states. And so Michigan has one of the highest levels of lead service lines, right? Which we saw from Flint, Michigan, now Benton Harbor, right? And then there's just various other places that continue to surface. Right, and so the National Resources Defense Council lists Michigan as the 3rd highest estimated lead service lines running throughout the whole state. Right, and so Michigan, it's a huge infrastructure issue there. And so again, thinking about, Flint water crisis. And so what does this really mean for us kind of moving forward as we are saying, because these are maybe examples of what I see in my communities. Like when I look and I'm moving around, traveling, these are the things I'm thinking about, the things that I'm kind of wondering about. Like, what is the work that continues to be done? Right, so thinking about social ecological justice, which for me is really talking about social justice and eco justice, but the two, you can't separate the two, because if systemic racism is a part of climate change, you can't say that fixing one thing means that you can just do that in isolation, right? You have to kind of work on things kind of in a mosaic, right? Piece by piece, in the sense to bring together parts to the whole. And so often really talking about the importance of holistic, frameworks, pedagogies, justice-based pedagogies within that, the promotion of culturally specific community justice work. And so I think of like within Detroit, there's been a huge surge of agricultural movements, urban agricultural movements, but even that has, continued to struggle just because of the, really again, thinking about policy laws within cities that prevent things like urban farming and urban agriculture. And so then I go to, it really is also about promoting environmental initiatives in groups, from the groups that really need it. So, for me, it might be Black American groups, but for other people, it might be something different. And then the application of those social justice ideologies to that environmental justice work, right? And so talking about really critical examination, and I guess that's where that idea of praxis comes from, like saying the work here is maybe not necessarily for me all the time, but how can I look to who else needs it? Because if I help somebody else in this context, I'm also probably helping myself. And as a part of that dismantling, really a lot of these ideas and beliefs that we have, rather about climate or race, and really trying to challenge ourselves to understand things from what people are experiencing, in the other individual's perspective. And then committing to ethical and social action in your own communities. And so what does that really mean? Right, and so that makes me think of the importance of localizing our efforts. So really thinking about identifying, supporting, challenging systemic bias, and speaking to those in your community, right? So taking time, identifying injustices that you see in your own communities, right? So what do I see as far as what's our air quality within our communities? What is our water quality? What are our local politicians doing for these purposes, right? Are they saying we want to endorse environmental protections, but are they actually doing that within their legislature work, right? And so I think kind of in that sense, holding people's feet to the fire, right? In a little sense to say, you're here to serve us. We also need to see that. Right, so taking the time to research the history of your area, right? So I just kind of showed you a little backdrop in how I research really my own history of my own area, partially because that is my family's history and my cultural history. But I think anybody can do that. If we're talking about support, find groups that are already doing the work. Like there's so many groups out here that are continuing to do justice work. It's just a matter of finding ones. And I think doing our work to understand who we're supporting, right? Whether that means money, social media posts, volunteering, etc. And then if we're challenging those systemic biases, we need to, again, I think, push our representatives to say, hey, you need to be showing up where we need you to show up. Right? And then lastly, speaking to people in your community, right? So for me, it's talking to people in the ADOS Black American community to say, hey, you're also here and this is why this is important, right? And trying to, I think, raise awareness and understanding, right? And stake, right? If people feel like they have a stake in something, they're more likely to take action. Okay, and then that is pretty much all I have. So just some reference slides. Okay, thank you.
Okay, great. Thank you to all of the presenters today for your expertise in climate change and mental health. You all, provided some great information, very informative. We do have a few minutes left of the webinar. If anyone have any questions, please share in the Q&A box. But I do have a question here. Even though, and Dr. Finley, this is for you, even though so much time has passed, are there any studies showing people still impacted by Hurricane Sandy, such as mental health? I think you're on mute. Oh, there you go.
Okay. I don't know if it's currently published. We actually just published a recent study about the ongoing long-term nature of these severe impacts. That S-CAFH, the Child and Family Study, is actually now connected with the Katrina. They're following Katrina, Maria, Irma. So there's a group of us working with the disaster group out of Columbia and out of NYU about this. If you email me, I can give you specific studies that are following up, and I can put my email in the chat. But yeah, we do know the long-lasting nature of the mental health impacts of specifically Hurricane Sandy.
Great, thank you. And what advice would you give someone dealing with climate anxiety? And anyone can answer this question.
I can answer that one. Really, I would say, it's kind of this piece about it, I think, being a marathon, not a race. It really takes this, I kind of think of it as we have to sometimes take a step back from things, but knowing when we need to step back, when we can engage. So having time to, I think, have direct connection with nature helps a lot. Getting out there and really just being able to enjoy spaces, parks, whatever it may be. And then also, I think, again, linking up with people in your community, other local organizations, to see like, okay, there are other people who are out here and they feel similar to me. And so maybe I can share some of that burden with somebody else.
Great, thank you.
Good. I'd like to add to that, if I might, to bring in the child aspect of that. I've done some work around teaching the educators and the school nurses across the state of New Jersey specifically about this. With children, it's good to listen to their questions, try to answer the questions honestly as you can. Sometimes, make sure you're answering the question that's being asked. There's a lot of ways that they could interact with it, with the environment, like Dr. Supre is saying. It's really important that they really get out there and do that. Older kids like activism, like Greta Thunberg, right? Older kids want to get out there and do that. So allow them to be active and hear their anxiety and talk about it as a family, as a community.
And I'll add too, I was in another discussion on mental health and climate change, and somebody asked about, there's still so much stigma around mental health and anxiety, and the speakers were saying how important it is to give ourselves grace, and that it's a totally normal reaction when you're watching what's happening in our changing climate to feel anxious when thinking about the future. And so, like Dr. Supre and Dr. Finley were just saying, like, finding community in that can be helpful.
Absolutely.